Welcome back to our final podcast of a series of podcasts created for Gambling Harm Awareness Month. Today's discussion will focus on wellbeing and mental hygiene for hospitality workers, as well as the impact of gambling on hospitality workers. Our guest speakers for this podcast include Dr. Jane Oakes, Dr. Quinton Black, Carol Black, and Professor Paul Delfabbro. To start us off, I'll introduce our guest speakers one by one. Our first speaker is Professor Paul Delfabbro. Thank you for joining us, Professor Delfabbro. Professor Delfabbro graduated from the University of Adelaide with degrees in arts, economics, and commerce. He also obtained a PhD in 1998 on the psychology of gambling. He has published extensively and has over 350 publications and 250 national and international referee articles in the areas of gambling, child protection, and applied cognition. For over 20 years, he has worked as a principal lecturer in the School of Psychology at Adelaide University. Welcome, Professor Delfabbro. Next, we will hear from Dr. Quinton Black. Dr. Black is a medical practitioner, clinical psychologist, educator, and researcher. He is the program director at PsychMed and has worked for over 38 years in mental health and addiction as a counsellor, psychologist, educator, and medical practitioner. He has run multiple programs for problem gamblers in SA since the early 1990s. He is a senior clinical lecturer in psychiatry in the School of Medicine at the University of Adelaide and a senior clinical lecturer in the School of Psychology, Society and Justice at the University of South Australia. We will also hear from Carol Black. Carol Black has been working in private practice since 1997 after obtaining a master's degree in clinical and health psychology from Adelaide University. She has been working as a psychologist for over 20 years and has a broad range of experiences in assessment and treatment of clinical disorders. She has a particular interest in drug and alcohol comorbidities and mood and anxiety disorders. Carol is passionate about ensuring that psychological services are accessible to all members of the community. And finally, we have Dr. Jane Oakes. Dr. Jane Oakes is a program facilitator at PsychMed, the largest community-based provider of mental health and addiction services in South Australia. She has previously held multiple senior positions at addiction treatment organisations and has extensive CBT experience. She has also completed her PhD on relapse in electronic gaming machine gambling. Now, I know that Dr. Black has a question ready to kick us off for Professor Paul Delfabbro.
Professor Delfabbro, I was wondering if you had any views around the research about some of the vicarious harms experienced by hospitality workers in gambling venues, and specifically perhaps some of the harms experienced by responsible host workers who have a role to identify when people are having difficulties with their gambling or indeed, in some cases, alcohol misuse.
There's been some research looking at the experiences of venue workers and how they cope in working with problem gamblers in venues. Also, general research looking at whether those people are more vulnerable to experiencing gambling problems themselves. I think one of the challenges with looking at this question is it does depend upon the venue. So some major venues, you think of some of the major casinos have dedicated centres for responsible gambling. They have very highly trained staff, often who are quite experienced in counselling on site. Quite different in many hotel and club environments where many of the workers can be quite young. They can be often only aged 18 and 19. And then be trained in responsible gambling and given the expectation that they may have to interact with people to identify warning signs of problem gambling. Now, many of the problem gamblers they will encounter will be people much older than them, many often quite angry people who are already displaying some signs of aggression towards gaming machines, often not interacting socially very much with other people in venues. So one of the major challenges from researchers looked at applying responsible gambling principles is that the hardest thing is actually approaching these patrons and giving them some information to suggest that they might have a problem with their gambling. Many people are not very receptive to that. And while there are people out there who self-exclude from venues because they recognise they've got the problem, it's much more difficult in those smaller venues, which we have a lot of in South Australia, for staff to unilaterally say, well, I think you've got a problem, I don't think you should be allowed to come back to our venue. That becomes a very difficult thing to do for inexperienced, particularly younger staff members. And so it's very likely, and certainly the case, that these young people have received abuse from patrons and been told to mind their own business, and even received some flack from management where their behaviour is seen as turning away, loyal, regular customers from the venue. So that's definitely a challenge, I think, which is not an easy one to solve. There is some research going on in New South Wales where I think the University of Sydney is doing some work looking at training for venue staff to look at better ways in which to interact with the patrons, better ways to approach them. One of the things that really speaks to the success of these sorts of interventions is having more experienced go-to people in venues, so a dedicated person who's a more senior staff member, better trained, used to dealing with complex patrons, and they're the person to whom more complex patrons can be directed, where the more junior person doesn't feel like they're able to do it. So I think that's certainly, I understand that's some of the sort of developments which we're looking at to enhance in South Australia.
Thank you very much. I think that some of the issues you raised there are really important to understand, and I appreciate the guest speakers early on raising some of the really strong, important points around helping people with training to develop their skills and approaches to de-escalation and working with people who are experiencing difficulties both with alcohol and with gaming. But also, I think it's really important that the managers who are supporting them or the senior staff also have that training to help them identify when younger staff and more inexperienced staff are having difficulties themselves. And so I think these are some of the issues that we're hoping to address with the new project that we've engaged in with Gaming Care South Australia in developing some of the support initiatives for hospitality workers and specifically people in the responsible gambling host roles. So, Carol, Professor Del Fabbro was talking about some of those risks and harms that are experienced by hospitality workers when confronting people about their gambling and trying to help them become more self-aware. Are there other risks that have been identified in research that are faced by hospitality workers in that role?
Sure. Research has identified that people working in the hospitality industry, in gaming venues, are at a higher risk of gambling and developing gambling problems themselves. And staff working in these venues are exposed to people with significant gambling issues. And as a consequence, research has found that they tend to normalise gambling and heavy gambling. It has also been found that they can develop an increased interest, familiarity and knowledge of gambling, increased erroneous beliefs about their capacity to win, and harmful erroneous beliefs about capacity to use skill to win. They're also at risk of engaging in higher alcohol consumption and thereby developing misuse or dependency problems, in addition to the sense of increased peer pressure to gamble. Also, some of the unique workplace stresses previously mentioned by Professor Del Fabbro can also contribute to urges to gamble as a means of coping.
Thank you for talking about some of those other challenges faced by hospitality workers. Could you tell us a little bit about, we often hear about workplace wellbeing and people building resilience. Could you tell us a little bit about how resilience can help in the workplace and help people cope with some of those stressors?
Well, there is some evidence that hospitality workers can benefit from resilience training. And resilience is the ability to cope with adversity. Often it's to do with loss, change and trauma, but also difficult and challenging situations. And building resilience helps us to adapt to life-changing events and cope with difficult times and also bounce back from hardship and adversity. Increased resilience means we can cope with feelings of stress, anxiety and sadness that can accompany adversity and can bounce back from setbacks a lot more quickly. Resilience assists in maintaining positive outlook and people generally having less fear about the future and uncertainty and cope with difficult periods in their life.
So Professor Del Fabbro was talking about some of the difficulties in approaching people about their gambling, and some of the difficulties for hospitality staff in the workplace coping with those sorts of situations. Could you tell us a little bit about other types of stress that could arise in the workplace?
So, work-related stress is often thought of arising as a result of demands from a person's work that exceed their capacity to meet or manage those demands. So, workplace stress can arise from a number of things in the workplace, including unreasonable time pressures or deadlines, heavy or unmanageable workload, lack of communication and support from managers, unfair treatment at work, conflict in the workplace, long working hours, and lack of awareness or understanding by the workplace of mental health issues.
So it can certainly be a difficult work environment with long hours and people working quite late, often in the hospitality industry. So you can imagine a lot of those issues adding to the issues of dealing with angry clients and patrons. Could you tell us a little bit about how this can lead to increased stress levels and some of the associated effects?
So, prolonged exposure to these workplace stressors can start to result in people feeling mentally and physically exhausted, anxious and depressed. They may notice their poor concentration or feeling distracted at work, feeling overwhelmed with being at work and performing their duties, a reduced performance and not completing their work. Negative opinions of themselves, work or others can start to occur, and they can find themselves getting upset or angry easily, feeling tense and edgy at work, feelings of dread around being at work, even being late to work or avoiding going to work or avoiding work activities involving others, and certainly distancing themselves from others at work and even at home.
So even sometimes after they finish work, when they go home, they might bring some of those negative effects home with them and find themselves not communicating effectively with their partners or not dealing with that stress. And I guess that kind of chronic stress can sometimes lead to burnout. Could you perhaps tell us a little bit about that aspect?
Okay, so burnout is thought of as a particular kind of stress that often can arise from work and is referred to as job burnout. Researchers have defined burnout as a psychological syndrome emerging as a prolonged response to chronic interpersonal stressors on the job. This often occurs in human service occupations, and researchers found that there are three key dimensions of the burnout response: overwhelming exhaustion, and this being emotional, physical and mental, which is often described by people as wearing out, having a loss of energy, feeling depleted, debilitated and fatigued. The second key dimension is feelings of cynicism and detachment from the job develops, and this is often described as inappropriate attitudes towards clients, irritability, loss of idealism and withdrawal. And the third key dimension is sense of ineffectiveness and lack of accomplishment, which is often described as reduced productivity or capability, low morale, and an inability to cope.
Thank you, Carol. So there's really two distinct types of levels of risk, isn't there? There's the stressors experienced in the workplace that can lead to that sort of difficulty coping and distancing and detachment from the workplace. And then I guess when that progresses to another level, it becomes more of a clinical issue that we would address as psychologists in a clinical setting. The sorts of things you described sound a bit like the precursors to symptoms of depression and detachment. So these are some of the things that I guess we can assess in other ways. So one of the projects that we're working on at the moment for Gaming Care SA is to develop a web-based information to help people build resilience and cope better in the workplace. We're also developing a mobile app for hospitality workers to be able to self-monitor and see how they're going against benchmark standards and engage in some strategies and perhaps practice some skills that will help them develop greater resilience. If they develop to that more severe or clinical kind of level, I guess what we really want people to do is talk to their GP and perhaps see a psychologist or a psychiatrist and engage in an assessment process that can identify the best and most appropriate and effective kind of help that they can follow up with. Perhaps could you tell us a little bit about some of those challenges faced by individuals at that clinical level and some of the types of therapy that might be helpful?
So at an individual level, people may find themselves requiring treatment for depression and anxiety. And so at an individual level, they'd be seeking individual therapy that would target treatment in those areas, but also potentially communication training, improving self-esteem if that was problematic, and developing resilience through resilience training.
And of course, there's specialised programs that focus on specific psychological clinical issues like trauma from experience in the workplace, or when people develop alcohol or other drug dependency issues or even misuse issues where it becomes a harmful or routine coping strategy rather than a social kind of outlet. And I guess the same is true with problem gambling as well. Now, there are often EAP services or employment assistance programs offered by employers in the hospitality industry, as they are in many industries, and that can provide helpful counselling and basically an opportunity to process some of those experiences and put them into perspective. But I guess what you're saying is when it gets to that level where someone develops symptoms of clinical depression or some sort of anxiety or post-traumatic stress symptoms, that then they maybe need to consult their GP and a specialist and have a assessment and follow up with cognitive behavioural therapy or some sort of focused version of therapy and maybe some medication that can help them get through those difficulties. There are also a number of help services and 24-hour national lines that are available. I know some of the ones that are really quite helpful when people are experiencing intense suicidal thoughts, like Lifeline and the Suicide Callback Service. Could you perhaps tell us about some of the other helplines that you're aware of that people might find really helpful?
Yes, there's the gambling helpline and Let's.
Just for people that aren't aware, Let's is a lived experience counselling service that's available in South Australia. The National Gambling Helpline number, which is a 24-hour number, is 1800 858 858. And of course, there's the South Australian Gambling Helpline, which is run through PsychMed, which is 8232 3333. And some of those other lines for younger people, perhaps, I think they often find that the kids' helpline is quite useful. A lot of men find the men's helpline is a very helpful 24-hour service. Are there any others that you would like to mention? Perhaps 1-800-RESPECT for women who are in situations with domestic violence. We know that often people who are in those types of difficulties do go to gambling venues sometimes because of the security and the public nature of the venues. So I know some women that I've seen with significant domestic violence issues have found some refuge, in a sense, in gaming venues, which can be problematic, I guess, because you've got to pay by gambling. So what can managers do at organisational level to really help staff to manage workplace stress?
Okay, so managers can work on developing awareness of the workplace stresses mentioned previously, and Perhaps in terms of working on management of these stressors, look at increase in staff training where they may cover risks posed to staff, the importance of self-monitoring or check-ins, reminders of availability of services, and provide regular retraining, particularly for newer or younger employees who may be more at risk. And ensure a strong culture of responsible gambling and alcohol use through information dissemination, proactive management, initiatives such as promoting Gambling Harms Awareness Week, and ensure secure support and feedback structures to help motivate and encourage hospitality employees.
Thank you, Carol. Thank you, Professor Del Fabro. I think people will find the information you provided really helpful, hopefully, and if they would like further information, they can go to our new website, which has a specific section on how to assist hospitality workers to develop their workplace wellness, resilience and coping strategies, and how to also self-assess to see whether they need to take those next steps to engage in more clinical type services, or whether they just need a little bit of counselling support and things. I believe there's also some information there for managers about how to help workers that are working for you to develop some of those skills that you were just talking about, Carol. So thanks very much for your time, and I greatly appreciate it.
Thank you everyone for a really interesting discussion so far. Finally, we will now hear briefly from Dr. Oakes. Dr. Oakes, could you comment on any knowledge you have in this area?
Gambling researchers have highlighted that there are many highly stressful impacts on employees working in gambling environments. For example, employees are expected to maintain high levels of service quality, be pleasant, polite and friendly, while ensuring they meet customer needs. This constant and unrealistic persona may mask the workers in this conflict. Also, this can contribute to feelings of emotional exhaustion and suppression of emotions, which can quickly cause burnout amongst these gaming employees. Besides, these workers must provide a responsible service of alcohol and gambling, which means they also carry an enormous sense of responsibility for patron welfare, and at the same time cope with heightened emotional responses by gamblers. For example, some customers often experience high emotions, including anger and distress, if they lose considerable amounts of money. Along with the responsible service of gambling, they can suffer many conflicts associated with their management expectations related to encouraging patrons to keep gambling. Added to this stress is the continuous exposure to supercharged, noisy and electronically stimulating environments, and also gambling. Other issues include shift work, which also interferes with the workers' family, social and leisure activities, where some venue staff experience social isolation on their days off and pursue solitary leisure activities, and can turn to gambling to relieve boredom and stress. And what we know from the research is that negative emotions, boredom and social isolation often underpin gambling problems. For some, gambling can quickly become an attractive pastime and a way to unwind, particularly as these workers tend to socialise with other hospitality workers who also work shift work. Therefore, mixing in a gambling environment can be an easy option, particularly to fill in time between shifts or when finishing work as a way to de-stress with colleagues. And shift work also makes it easier to hide heavy gambling, as significant others don't see the hours spent gambling after work or before work. Under these stressful conditions, many employees struggle to produce and be productive and committed to their workplace. Recognising and addressing stresses in the work environment is critical in preventing these employees' stress. Therefore, specific hotel management implications could include providing staff with training and education aimed at reducing the propensity to gamble, limiting staff access and exposure to gambling products after their working shift, and services. There are some specific hotel management implications, such as including staff with training and education aimed at reducing the propensity to gamble, limiting staff access and exposure to gambling products after their shift and before their shifts, and introducing strategies to assist staff with gambling problems to help reduce the negative outcome and consequences of gambling. Also, helping staff to maintain a work balance is an essential factor to help reduce stress. If organisations do not address this workplace stress, their ability to retain staff and have high service quality and productivity will be impacted.
So thanks for listening to our series of 4 podcasts we put together for Gambling Harm Awareness 2020. I'd like to just reiterate the website that was part of this project that was created is SA Gambling Help, all lowercase, all one word, .org.au. And the number, of course, for the South Australian Gambling Help Service, the Specialist Help Service, is 8232 3333. Or if you're living in rural South Australia, 1800 002 424. So that's 1800 00 2424. The National Gambling Helpline, which is actually 24 hours a day, is 1800 858 858. And the site actually includes general information about gambling and problem gambling, information about first steps to recovery and regaining control of your lives, information for health professionals who are wanting to engage in discussion with people around problem gambling and how to assess what type of help would be most effective for your patients, and information for hospitality workers. It'll also include ultimately 2 mobile apps, which will be downloadable, one for hospitality workers to engage in regular self-monitoring and exercises to help build workplace wellness and resilience, and also information around self-help to determine if you really need to seek professional assistance on top of that. And the final component of the project is to develop a gambling help service specialist service app, which will support the cognitive behavioural therapy program provided by the South Australian Specialist Gambling Help Service, SAGS. So thank you once again for listening. I hope this has been helpful, and all the best for the rest of the new year.